Hi, I'm Dr. Karin, owner of Chiropractic, and I'm going to be demonstrating on how to get into and off of your traction unit and give you advice on tractioning in general. So wherever your pain is, and for demonstration purposes, I'm going to say this is where my pain is, that's where you want to be between the two pieces that are going to separate. Now you don't want to lay down like this because that can hurt your back, especially if you have a disc herniation. You want to make sure that when you lay down, you want to keep your spine straight. The easiest way to do that is to go onto your side, put your elbow down, get where your point of pain is. I need to move up a little bit. Go all the way down to your side, and then go onto your back. It's best to have a wedge pillow for your knees. If you don't have access to a wedge pillow, you could also use a bolster or a rolled up towel. The next phase is to put the bottom piece in. Your first time, it would be best to have somebody to help you, because you don't want to be doing this and to cramp the clips in place, because doing this, you can hurt your back, okay? Now, in the later phases, when your disc is all healed and you're doing this for maintenance, you'll have the ab strength to go ahead and do that, but at that point, you'll be so good at tractioning you won't even have to look and see what you're doing. And then the second part, wrap the material over your chest. Grab the lowest one. I don't think I have, there it is. Snap it in place. Now the newer models only have 2 straps per segment. This is an older model, so it has 3. Then you want to grab your pump. Now how the pump works is there's a release section, a pump section, and a hold section. So you want to make sure you're on the pump section and you start pumping. It'll start tractioning you apart. You watch the pump as you traction. And when you get up, I like starting people at 45 pounds of pressure for their first session of traction, and then you put it on hold. And you just lay here for 10 minutes. Now, you might notice the pressure going down over time. Your first time on the traction, you should let it go down. I wouldn't repump, but as you get more comfortable with traction and know it's really good, you could always go back to pump and give it an extra little pump if you've lost some pressure and put it back on hold. And over time, and again, depending on your specific case, really communicate with your healthcare provider what is a good poundage for you. A lot of people do well with 60 pounds of pressure. Some people will go up to 75 pounds. Again, it's really condition and person specific. After 10 minutes, the technical way of getting out of your traction is to release till all the pressure's out. Personally, I don't like releasing all the way to 0 because I feel like I get recompressed when it goes back to 0. I basically release it until I feel it not pulling me anymore. At that point, I stop because I don't want it squishing me all the way back together. And then you just unclip all the straps. I like putting the straps out of my way. And then take the material away, the lower section. Taking off the material. Now getting out is really, really important that you don't hurt yourself, because right now the discs have been hydrated, and if you put too much pressure on that disc, it's just going to blow it all back out again. So take a minute, assess yourself. Maybe this is a good time to do your pelvic clock, where you do pelvic tilts in the 12 and 6 o'clock position. And if that feels good, maybe do the 3 and 9 o'clock position, just to kind of see where you are in space, see how you're doing with that movement. If you're feeling pretty good and solid, then contract your lower abs, make sure you're nice and solid. Lift one leg, see how your back is doing. Make sure you're getting no radiation of pain, no nervous tingling weakness. Then raise your other leg. I like raising my non-symptomatic leg first and then the symptomatic leg. If that's all doing well, then turn your whole body together as one unit off to the side. See how you're doing. If you're doing okay, on the exhale, so I like to take a breath in, and as you exhale, push yourself up halfway. See how you're doing, because if something's going to go wrong, it's going to be a split second and it's too late. So really take your steps on getting out of the traction unit. And then the second thing I like to do is going onto my hands and knees. See how your back is doing. If it's doing okay, maybe do some cat-cows to explore the movement of your spine. Do at least 3 of them. Warm up the back to the new space between the bones. One more stretch. And then going on to a seated position. That's your first weight-bearing position. If your back is doing okay, then it should be okay for you to get up. And what I like to do is do one leg first, and then the other into a squat, hands on knees, and stand on up. So if this is too difficult for you to get up from this position, I'm going to show you how to get up using a chair. Again, engaging your core, going onto your side, like we did earlier, and then going onto your hands and knees, doing some cats and cows, at least 3, remember, to see where you are in space, getting used to that movement. And then very carefully, you don't want to twist to get to the chair because that can throw your back out. You want to keep your spine as straight as possible as you shimmy over to the chair. Put one hand up to it, check your back. Remember to engage your core. Breathe out as you put your other hand up because you want the pressure to go out your mouth, not out your back. And straighten up your spine as much as you can. See how your back feels with that extra weight. If that's feeling okay, put one foot forward. Assess yourself. Maybe put your hands up higher if you can, so you have room for the other foot. Tuck your toe in first. Straighten your back leg. Keep your back straight. And then bring your foot forward. Check your back. See how it's doing. Put a lot of weight on your hands. And slowly shift your weight back onto your feet so that you can lift one hand up onto your knee. Make sure you're doing okay. Do another breath. Breathe out. Put your other hand onto your knee. And walk up your legs as you stand on up. Keep your knees soft. And then stand up. Did you see how slow I was? And again, there should be no twisting of your spine. That's when you're going to hurt your back. If you have to turn, use your legs. Keep your back very stiff and still after tractioning, because it's going to be very hydrated. There's more space in between your bones, and if you twist, you can just shoot that extra fluid back out. Again, avoid any activity that causes numbness, tingling, or weakness, or radiation of pain down any leg, because that's a sign that you're pinching that nerve. You want that pain to centralize to your back and eventually heal and go away altogether. One thing I want to make sure that you know about the older units is that when you first open them up, there's these little clips here, and if the clips are not clipped in properly, then it won't traction properly. Another tip I want to give about the traction units is that when you store them, make sure that they're set to release, because that keeps all the pressure out of the pump. The life of your pump will last longer if you store it in the released position. So I can't stress enough, talk to your healthcare provider to see what your specific needs are. Typically, it's advised to traction 3 times a day for 10 minutes each time, and building up the poundage that your healthcare provider should give you a number for that one, but generally we start at 40 pounds and build up to a higher number. I hope this has been helpful, and until next time, stay well.